Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual. And today we have discussion of some very important rules. We're still in the clinical care tips category, subcategory of About You, the provider, part 4. Rule number 73. When you have nothing to lose, you can only win. So I'd like to demonstrate that rule by giving another example. Usually my examples are the best way I can do this. Let's say I see a child in the pediatric emergency department with bronchiolitis. He's less than 2, he's wheezing, it's the appropriate season, and I try to treat him by adhering to the guidelines, which basically means suctioning him and hoping that his respiratory distress will be alleviated. Certainly I treat the fever, maybe give some fluids, maybe I give some oxygen via nasal cannula if the child is hypoxic. But if the child is in significant distress and everything I've done has not been helping, I think it's no big deal to try to give one dose of albuterol. Yes, albuterol is not in the guidelines, and no, albuterol has not been shown to help kids with bronchiolitis. But if I'm about to intubate the child or even put him on high-flow nasal cannula, I think it's worth a try to give him some albuterol and see maybe he's one of those kids who actually respond to albuterol despite having bronchiolitis and not asthma. So if I have nothing to lose, I can only win. So although albuterol is unlikely to help, it's not a big deal in my world, and if that's what's going to prevent intubation, why not? Another example is if I see a child in the pediatric emergency department that is truly lethargic. Let's say a newborn, and I do some workup. He's acidotic, but he's not febrile, he's not hypothermic, and my working diagnosis is maybe some metabolic disease. Although the child has no fever and he's not hypothermic and infection is not very high on my list, I probably will end up giving the child one dose of ceftriaxone, just in case this is an unusual presentation of an infectious process without fever or hypothermia. For the most part, for most metabolic diseases, there's really no definitive care I can provide in the emergency department other than maybe fluids, checking the glucose, etc. But if I suspect this is a metabolic disease, but the child behaves as if this could be a serious infection, I think I have nothing to lose by getting a blood culture and giving one dose of ceftriaxone. So, rule number 73. When you have nothing to lose, you can only win. Rule number 74. There are no mistakes, only lessons. This rule is a tough one. I think as humans, we all make mistakes, and we have to recognize that we have mistakes. Certainly mistakes in the medical field could have some serious ramifications. I certainly understand that. But unfortunately, since we're all humans, we all make mistakes. And sure, in the pediatric emergency department, as a physician, a mistake can have some maybe serious consequences. But I think it's important for us to view mistakes as lessons. So every time I make a mistake, I make a note of it, even just write it down or just a mental note, and I make sure I do not repeat that mistake in the future. For me, this is a lesson, and it's a very good lesson. If I send home a child with abdominal pain, and a day or two later I hear or I see the child that came back with a perforated appendicitis, I try to go through my notes, see what I did, recall the event, and think if I can do it better the next time or if I can learn from that mistake. So I try to think of my mistakes as lessons. I think if you perceive your mistakes as lessons, you're more likely to learn in the future and make the best of the situation, and hopefully not repeat the mistake again. Whereas if you think of them as pure mistakes with no benefit, it's just hard and discouraging and makes the learning a little bit more challenging. So in my view, there are no mistakes, only lessons. Rule number 75. Accept some degree of chaos. So this is a rule I learned the hard way when I started doing attending shift as a fellow in the pediatric emergency department. And I remember discussing this with one of my attendings after my very first attending shift, and I explained to him how I felt it was a little bit messy. I don't think I was in good control of the situation. I was kind of frustrated about it. And he said something that really stuck with me. He said, Yaron, during your clinical shifts, accept some degree of chaos. The pediatric emergency department or the emergency department is, by definition, most of the time, a very chaotic place. Patients come in nonstop, some of them very sick, some of them need a lot of attention, some patients who are not very sick, the parents need a lot of attention, and it often gets a little chaotic. I think it's important to accept some degree of chaos while trying to remain in control for the most part. So certainly, you don't want to lose total control. You don't want to forget about your patients. You don't want to make mistakes and put orders on the wrong patients, etc. But it's important to understand that it's always going to be a little chaotic. As long as you are in control for the most part, see the patient, think about what you're going to do, plan ahead, and do what's right, it's okay if the place is a little chaotic. So think about it when you work your next shift in the emergency department. Accept some degree of chaos. Try to keep the chaos to a minimum. Try to have the best control you can have. Try to make sure you follow up on your patient and do the right thing, but accept it's not going to be perfect. Accept some degree of chaos. And that is it for today, guys. Thanks again for listening. Appreciate your time. Hopefully you can tune in the future. Let's review what we learned. Rule number 73. When you have nothing to lose, you can only win. Give some albuterol to the bronchiolitic patient who is in dire straits. Why not? Give some antibiotics for what you think is an infectious process that you haven't specifically identified. No big deal. When you have nothing to lose, you can only win. Rule number 74. There are no mistakes, only lessons. All of us make mistakes. It's very human. If you think about them as mistakes, it's just going to bring you down. Think of them as lessons. Lessons you can learn from in the future and hopefully not repeat again and again and again. So there are no mistakes, only lessons. Rule number 75, accept some degree of chaos. You're not perfect. You're not going to be perfect. And if the pediatric emergency department is very busy, as long as you're in control of most of the situation and do what's right for the patient, you can accept some degree of chaos. Thank you very much for listening. I hope you tune in the future. Again, check out PEMRules.com, submit any feedback. If you want to hear any topics for any specific future episodes, I would love to hear from you. Hope you have a great day. Hope you like the outro. Bye, guys.